Hello everyone, this is Ms.M.Fathima Aafreen, Assistant Professor, Department of Nutrition Dietetics, SFO College for Women. So in today's topic, in this video we're gonna see about phenylketonuria. So let's get into the video. So the contents of the video gonna start from the condition. We will be seeing about the causes, severity, symptoms, PKU and its complication with the pregnancy, the diagnosis, prevention and diet. So let's pass on to the contents. So phenylketonuria, it's basically an inborn error which happens due to the enzyme defect occurring in the amino acid metabolism. Amino acid is in small molecule, so it is related to the small molecule disorder. So PKU is a rare condition that is also an autosomal recessive inherited disorder. This causes the amino acid phenylalanine. Phenylalanine is an essential amino acid that is required by our body. We will be taking it from the diet. So that particular amino acid phenylalanine gets built up in the body just because the enzyme is defect. The gene mutation happens in the production of the particular enzyme. The particular enzyme related to phenylketonuria is nothing but phenylalanine hydroxylase. This phenylalanine hydroxylase is essential for the conversion of this essential amino acid phenylalanine into its other metabolic products. Other metabolic products essentially or mandatorily into tyrosine and also to melanin and etc. So the condition, as we said, PKU is caused by the impaired activity of liver enzyme. Phenylalanine hydroxylase is an enzyme that is produced in the liver. The gene required for the production of the enzyme is mutated. So what happens? The enzyme is lacking or it is produced in the very minimal level. So this causes the phenylalanine to stop from converting into its other metabolic products. So phenylalanine gets accumulated in the body and it's not converted into other products. So it may also, in rare conditions, phenylketonuria is in rare condition. Also sometimes in rare conditions, tetrahydrobiopterin, it acts as a coenzyme. If the coenzyme is not produced properly also, the patients will, the individual will exhibit the phenylketonuria, that is build up of phenylalanine hydroxylase. PKU is more adversely related to progressive neurological disorder. The accumulation of phenylalanine causes the progressive neurological disorder. Okay. So next let's pass on to the causes. So as we saw earlier, it is an autosomal recessive inheritance. This is a hereditary condition. We have defined it, right? Inborn error of metabolism. So by birth this condition is seen or noticed in the individuals. It is an inheritance condition that occurs due to autosomal recessiveness. Autosomal recessive, that is both the parents, father and mother, must have that condition and they pass on that to their children. The defective gene, the gene mutation is present in the parents as the carrier. They are not the evidence or victim of the disease particularly, but they carry the defective gene and they pass on to the next generation when the conditions are favorable. This may happen or may not happen, it's all in the hands of God. So this condition occurs only when the favorable situation occurs, where both the parents are carriers and they are not the actual victim of the disease. Okay. So the gene mutation is the main reason. Mutation of the gene which is responsible for the production of enzyme. The enzyme is phenylalanine hydroxylase, which helps in the metabolism of phenylalanine to tyrosine, melanin and other products. So severity. The severity ranges differs. Okay, it differs from classic to less severe forms. So classic is the most severe form of PKU. This causes this takes place when the enzyme is severely reduced. That is, there will be no protection or very less protection of phenylalanine hydroxylase. So this may cause the severe brain damage, even irreversible brain damage. Irreversible means there will be no getting back of the condition. That is temporarily, permanently the brain damage will happen. So next, less severe form. Less severe form is not that severe to as that of classic PKU. This form happens when there is the enzyme is absent in minimal, or the enzyme will retain very certain some of the functions only. So phenylalanine levels are not so high, so the accumulation will be not as high as that of classic PKU. So the brain damage or neurological dysfunctions will be very less when compared to classic PKU. So passing on to the symptoms. So it's diagnosed in the earlier forms. It is an inborn error. So in the earlier forms, the children or that individual will be exhibiting all these symptoms. So the major symptoms are musty odor in the breath, skin and urine. When they pass out the urine, there will be a musty odor. We can visibly notice the musty odor from the persons who are with PKU. Also they exhibit eczema, that is skin related disorders will be or diseases will be exhibited by the persons. Also many neurological dysfunctions, as we saw earlier, there will be number of neurological complications like convulsive seizures, delayed development, intellectual disabilities, psychotic disorders, also bizarre behavior. The children will be abnormally behaving when compared to normal child. Also emotional social problems will be engulfed by the children. So if the condition is leaded to the classic PKU level, then there will be an irreversible brain damage. Also we could notice there is flare skin, blue eyes and blonde hair. It's not direct attack of phenylalanine accumulation. This may happen because phenylalanine is in need to convert into tyrosine and melanin. So these two proteins are essential for giving the pigmentation. Melanin is a pigment. So this is responsible for giving pigmentation for our hair, skin and eyes. So when the phenylalanine is not converted into the useful forms, then the particular tyrosine or melanin is also not produced in the needle level. So this may cause these symptoms. Also when the child is born with this condition, the head of the child will be in minimal size, that is microcephaly. The condition is called microcephaly. So moving on to pregnancy and PKU. So if the parent, the mother is a PKU patient, or the child in her fetus, in her womb is an PKU patient, means what are the complications are going to be seen? That is miscarriage. The pregnancy may get miscarriage, or the baby who is going to come out will be of low birth weight. The baby will exhibit a delayed development, and we saw earlier microcephaly, facial abnormalities will be shown by the child. Intellectual disabilities are also, the child will exhibit behavioral problems. Some children will also exhibit heart defects and heart related problems. So passing on to the diagnosis. So as we saw, it is diagnosed in the earlier stage, even at time of birth. So after the baby is born, within 1 or 2 days, the blood test is taken, that is screening test is done for the baby. So for that, the blood is taken from the baby's heel, and it is tested for the presence of phenylalanine accumulation or the loss, or it is also tested for the presence of PAH gene mutation, that is phenylalanine hydroxylase gene mutation. So if the test is giving the result of the presence of phenylalanine accumulation, then the confirmation test is done within 6 weeks. Within the 6th week of birth, the confirmation test is done. It is also a blood test. Sometimes for some individuals, the symptoms will be shown, or they will be noticing the symptoms at some growing stages, or even in the adult stage they will be showing. So at that time they can go and test for PKU if the symptoms are related to the diagnosis. Also PKU is not a lethal condition. The patients or the individual can survive their life by managing their diet and also taking some control measures. Adult of average age 57 years is noticed alive with PKU. So as we saw earlier, prevention is only following a better diet and maintaining their life with control for PKU. During pregnancy, so genetic condition, we have seen this as a genetic condition. So considering genetic counseling can help prevent this condition or help to maintain how we should behave in our pregnancy period. We can get some idea about this genetic conditions. So next, getting into the diet. As we saw, phenylalanine is an essential amino acid. Amino acids are building blocks of protein. So we should include a low protein diet. We should follow a strict low protein diet with restricted phenylalanine. If we limit the intake of phenylalanine, there is no need for its metabolism. So restricting phenylalanine is more helpful for the maintenance of the condition. So aspartame, an artificial sweetener, is known to have aspartic acid as well as phenylalanine in it. So people should avoid taking aspartame who are in this condition, PKU conditions. So what are the foods to be avoided? So we're gonna see the foods which are rich in protein: milk, nuts, egg, cheese, also chicken, beef, fish, soybeans, whatever. We know what are the foods rich in protein. We are in need to limit and maximum avoid it if they are known to have phenylalanine in it. Also some foods are to be limited. Potatoes, grains and some vegetables are in need to be limited. For infant, it is diagnosed in earlier stage. So if they are found to have PKU, they can be given a phenylalanine free formula, that is low phenolac. Doctors will be recommending this. So along with the breast milk, they can take low phenolac. Also US Food and Drug Administration, FDA has found and approved sapropterin Quan as a treatment for PKU. It's not treating the disease, it can control or lower the level of phenylalanine to a maximum. So this is what the diet for the PKU. So we can't prevent this condition as it is genetic condition. We can manage it by following a better diet, also especially having a low protein diet and restricted phenylalanine. So thank you for watching the video. It's really happy. Let's meet in the next video. Thank you.